In 2008, I was diagnosed with type 2 diabetes. I experienced a non-STEMI, which is a heart attack. I live with depression and anxiety and also sciatica. My diabetes was out of control. My birthday was coming up and I was going to be 50. And I said, I'm not going into it old and decrepit, I'm going to be sauntering in. So I started to see both Dr. Imordi and Rebecca.
I've been seeing Francine probably for a year now. She's a lady who actually looks after everybody else, runs a voluntary community service. And I was like, Francine, we need to look after you. We sat and we unpicked what she needed, and it wasn't just diabetes care, I mean, that needed looking at, but it was like her social situation, her mental health, she had back pain. So we kind of looked at her from a holistic point of view.
I met Francine in one of our multi-morbidity clinics. Her HbA1c, which is a measure of diabetes control, was extremely high. Through our discussion, it was quite clear that there were other factors that were barriers, really.
I told him that I need to find things within our community that would help with my mental health.
We try as much to find out what matters to Francine, and then we start to find suitable resources within the community. Francine wants to engage into cookery so she can know more about nutrition.
As you feel better, you start to be able to cope better, and then you start to take responsibility of your health.
The last thing we did probably towards the end was introduce the GLP-1 injection, which is an amber drug. So we then presented her case to the multidisciplinary team.
They requested to start a medication called a GLP-1 agonist, which requires initiation in a specialist care setting. We were able to authorise the initiation of this medication, which has saved Francine being referred to the specialist team.
So we have MDTs every 2 weeks. Every 6 weeks, the diabetes consultant or the renal consultant join us. So it's a really good way of working together with secondary care, but at the same time also reducing patients having to go to hospital for appointments.
The typical provision of healthcare is seeing one doctor for one part of your body and another doctor for another part of your body. All of these diseases overlap. Working within the multi-morbidity model of care has really broken down barriers to allow us to treat patients as a whole. As part of that, we've engaged with patients in a point of care clinic, which means you can have a blood test done there, and we discuss disease and talk about lifestyle options and sort of holistic management of early disease and how we can protect you to stay well for longer.
When it comes to Francine, that proactive input actually meant that she can be managed within primary care with secondary care sort of involvement if required, but Francine can actually deal with people she knows.
My sugars went down to 45, which put me back into the pre-diabetic range, which is amazing.
And patients come in, they want to feel like when they walk out the door, they're not just forgotten. And that to me is what this project is about.
When I hit 50, my whole lifestyle had changed, my whole outlook on life had changed. I'm looking forward to my life, my new chapter, and what's ahead of me.